And when we became a chapter with HOSA, there was like 100 people. So we were one of the first. And as I've only been doing it for 15 years, when I saw what it does to these students and they put on that blue suit and that professionalism, something just changes in them. And they really feel they're empowered with knowledge, even though they may not think they have it, they can act that way of it. The leadership, I think the piece of it that's really unique for HOSA and for our students is because they see something that, again, they take that ownership to. And they're like, hey, that guy's wanting the same thing I want. And they find that relationship together, and they find that comfort level, and they find that they can be something that they didn't think they could be before. So when we get into the competitive piece of that, we tell them, you're the best. And it makes them feel so good about themselves. And then they become that natural leader, or if they're not the natural leader, they're the person who wants to be a part of that team.
With HOSA, from what I see, it's an organization that instills confidence into the students, not arrogance, but confidence. Confidence to where that student feels that they only have one way to go, and that's up, that's higher, whatever it might be, whether it be education, professionalism, communication, they're going somewhere, and that's up.
When you're in HOSA, you compete in different events, and I've been competing in CPR and first aid. So I'm a two-time bronze winner. Some of the skills that I've learned at Cal HOSA is being prepared and studying.
We compete in things from CPR and first aid, EMT, CERT, medical assisting. Those are the professional events. The students can do knowledge tests, they can do creative problem solving, biomedical debate, they can do extemporaneous writing, extemporaneous speaking, prepared speaking. They can do teamwork events, leadership events, community awareness. Our students have done exceptionally well in the skill events, and I think it's because we put so much of the theory base in the class and then the application. And that's one of the areas that we excel in, and it's one of the areas that the students say, well, this is a skill of something that I can use every day. And that's why we do very well in those competitions, and they become the leaders of those events. HOSA has broadened the different events that they can do. We let our students choose the event that they want to feel comfortable to compete in, so that we feel that if they want to do it, they're going to excel at it.
Being in the academy, part of our program is we get to go and do internships at the hospital. We shadow different healthcare providers, and I really got to see, what each healthcare provider does: the respiratory therapist, the nurse, the doctor, the PA. And nursing just really stood out to me for the reason that, we get to be at the bedside with the patient most of the time. We get to interact, get to know their background, why they're here, hold their hand, talk to them. And I like to build that relationship with my patients, and that's what attracted me to it. The way that the Health Careers Academy is, the curriculum is developed, as well as the internships, was very similar to what my nursing school curriculum was. My first 2 years of nursing school was, taking all my classes, theory classes, pathophysiology, chemistry, all those classes that would prepare me when I would be in the hospital. And so, when I finally got to do my clinical rotations in nursing school, it was all very similar to what the Health Careers Academy internships were like. I got to shadow another nurse, be at the bedside, and really get to know my patients just like I did when I was in the academy. So it was definitely, I value the time that I had here in the Health Careers Academy because it really prepared me for nursing school.
So my entire life I've always been around the hospitals, or somebody was usually sick in the family. I had family members with cancer and some really hard diseases, so constantly in and out of hospitals, doctor's appointments and whatnot. And I would always go and visit, and I was always so intrigued and would ask questions, and I felt like that was where I wanted to be. I wanted to learn more, I wanted to do more, I wanted to help people. I love helping people, and I figured what better field than medicine. The classroom experience was phenomenal. It's funny that you ask, because I work at 2 different hospitals, and one of the hospitals I work at, I literally was asked by one of my attending physicians to go back to the basics, vital signs, and that was one of the first things we learned in our junior year, was how to take vital signs, just basic vitals, and thankfully, because of this program, I knew how to do that. So that was one thing that I was comfortable doing and can go back to and doing. They taught us a lot. The last year of high school, we get to apply for a position in an area that we want to go to and spend our full year in, which is our internship year. I wanted to go to the emergency room. So I applied there, pretty great. We have to have a resume, dress up. We actually literally get interviewed by people from the community and hospitals and clinics. And I was lucky and I got a spot at one of the local hospitals. At the time, it was Lancaster Community Hospital. So I applied, got my internship, and about 3/4 of the year, they offered me a job in the emergency room. So I was doing my internship, and then I was working as well before I graduated high school, which was really nice to actually have a job. And so it was very helpful coming up with having connections, meeting new people, obviously getting my first job, my foot in the door at the hospital was really nice. And then I ended up switching over to the other hospital where I was at ER Tech for 10 years, Antelope Valley Hospital, and that's currently where I'm at now as a physician assistant. So it's just a continual process. Everything just ends up connecting together. So the benefits of the internship program was great, especially when it came to getting the job, learning how to deal with patients and how to connect them to the monitors and how to be able to look at someone and know whether or not they're really sick or if there's a problem. So, you know, if you're hooking somebody up to the monitor and they're a little pale or don't look so well, you know, you learn to pick up on things like that, and you can alert someone right away. Learn how to do things like electrocardiograms, and doctors and nurses teach you things along the way as far as different procedures and different techniques and signs and symptoms and disease processes.
What I like about the Health Careers Academy is that there's many experiences and opportunities that can be found in the Health Careers Academy. When you go into the hospital setting, there's many facilities that you could be in, and then have more experience in the facilities and like what you really want to do. When I first came in the program, like I didn't really know what I wanted to do, like kind of more with my future.